So today we are going to discuss autoimmunity and what is autoimmune diseases. So mechanisms involved in the tissue damage they are very complex, and in a number of autoimmune diseases more than one mechanisms can be involved. For example, IgE or autoantibodies which occur in type 1 hypersensitivity reactions, it is rare but a possible example in milk allergy in Jersey cattle. IgE antibody responds to alpha casein. The second can be cytotoxic type 2 hypersensitivity reactions. In this, autoantibodies develop to the cell surface. For example, RBCs. In RBCs, there occurs autoimmune hemolytic anemia, thrombocytes. When it is involved, it results in autoimmune thrombocytopenia. The third can be immune complex, that is type 3 hypersensitivity reactions, in which autoantibodies, that is the antibodies plus antigen, that is Ag, they form an immune complexes and get deposits on the organs. For example, SLE and rheumatoid arthritis. Type 4 hypersensitivity, in which T cell mediated damage can be seen. They are primarily involved in the tissue damage, for example, autoimmune thyroiditis, ulcerative colitis, insulin dependent juvenile onset diabetes, and autoimmune encephalitis. Basically, the T cells are involved in almost all the autoimmune diseases, particularly in organ-specific autoimmune disorders. It may be due to the lack of T regulatory cells or the participation of T helper 17 cells. Macrophages, which are activated by T cells, are also involved sometimes in the tissue damage, the release of toxic enzymes and oxidative free radicals, which especially occur in type 4 hypersensitivity reactions. Most of the autoimmune diseases are characterized by the production of antibodies directed to the self-antigens, which are hence known as autoantibodies. So we can say here that the autoantibodies physical properties basically determine its pathogenicity, which includes its affinity to the antigen that play a major role in the immune complex formation, which we have already studied in the previously in the mechanism of tissue damage, that immune complexes formed by the by the combination of antigen and antibody immune complex that results in an immune complex formation. So it's autoantibodies, the charge present, it's charge that helps antibody attaches to the, how it is attached to the tissues, the charge which is, it's basically charge that helps antibody attach to the tissues. For example, in SLE, positively charged autoantibodies, that is anti-double stranded DNA, associate with the negatively charged basement membrane in the kidney, where they can form complexes in C2, since positively and negatively charged attract each other and there is a formation of an so the antibodies get attached to the tissues in situ with DNA and lead to the local inflammation. And we can see that most of the pathogenic autoantibodies are of IgG isotype. Now the types. Autoimmune diseases are divided into three clinical types. First is the organ-specific autoimmune disease. When the autoimmune response targets a specific organ or tissue, it is called as organ-specific autoimmune disease. Systemic autoimmune disease, sometimes called as collagen vascular disease, as it targets connective tissue and the vascular system. The third is the hemocytolytic autoimmune diseases. So the types of autoimmune diseases, as I have already told you, it is organ specific, non-organ specific, and the blood related disorders. So organ specific में it is examples are autoimmune thyroiditis, skin diseases, autoimmune reproductive diseases, hemolytic anemia, myasthenia gravis, autoimmune ophthalmic diseases, insulin dependent diabetes, and autoimmune adrenalitis, autoimmune neurological diseases. Whereas non-organ specific, it includes SLE, rheumatoid arthritis, polyarthritis, dermatomyositis, multiple sclerosis, possible autoimmune alopecia areata, and steroid responsive meningitis. We can now judge the difference between the organ-specific and non-organ-specific autoimmune diseases. Organ-specific is localized to the given organ, that is, antigen is localized to the given organ. Whereas the non-organ-specific, that means it is widespread throughout the body. In organ-specific, the lesions, antigen in an organ is the target of immune attack, whereas non-organ-specific cases may immune complex deposits in many tissues, for example, skin, joints, and kidney. Now, overlapping, it means that with other organ-specific disease, there occurs an overlapping, but in non-organ-specific, there occurs no overlap with the non-organ-specific diseases. So something now about, firstly, about the hemocytolytic autoimmune diseases. In this, firstly, we will talk about autoimmune hemolytic anemia. In this, the self-antigen which is present on the RBC membrane protein, autoantibodies to the RBC's antigen trigger complement-mediated lysis and hence antibody-mediated opsonization. So the RBC's membrane protein में self-antigen present होता है, autoantibodies उसके खिलाफ trigger करते हैं, and this leads to the complement-mediated lysis. Next is the drug-induced hemolytic anemia. In this, the self-antigens are present on the red cell membrane. Drug जो होती है वो alter कर देती है red cell membrane, which results in an hemolytic anemia. For example, penicillin और methyl dopa जो होते हैं वो interact करते with RBCs so that the cells become antigenic in nature, and hence the autoantibodies are developed against these antigens. Now the pernicious anemia. In the pernicious anemia, the deficiency of intrinsic factor, which we all know, results in an inadequate and an abnormal formation of erythrocytes, and there is a failure to absorb the vitamin B12. Hence, there are formation of autoantibodies against the parietal cells of gastric mucosa against intrinsic factor, which helps in the transportation of vitamin B12.